Hi everyone and welcome. Can you believe we are almost halfway through the year already? Time really does fly. We're really glad that you could join us today. We're excited to show you how Blue Mirror can support aged care facilities with practical, hands-on IPC training, especially with the upcoming changes kicking in from July 1st. Before we dive in, just a quick bit of housekeeping. Today's session will run for about 30 minutes, followed for some time for Q&A at the end. You'll all be on mute during the presentation, but if you have any trouble hearing us, just try exiting and rejoining. That usually does the trick. Feel free to pop your questions into the chat at any time. We're keeping an eye on it and we will answer as we go or at the end. And yes, this webinar is being recorded, so we'll send a replay out to everyone in the next few days, and it will also be available on our website. Quick look at the agenda for today. A brief introduction from me if you haven't met me already. A common look at the IPC training challenges in aged care. A video of a demo of Blue Mirror in action, a breakdown of the features and customizations available, an overview of our Blue Mirror 360 promotion, and finally some time for your questions. So, a little bit about me. I'm Chloe Hunt. I'm the National Sales and Account Manager for Australia and New Zealand. I've been working in healthcare for over 15 years across primary, secondary and urgent care settings. My passion is all about improving patient outcomes and supporting people who deliver care every day. I know firsthand how tough it is and how it can be and how important the right tools are. Also on the webinar today, we have Holly Hodgson, who you may also know. She is a registered nurse and our global head of sales. Holly will tell you her focus is always the same. She wants solutions that bring positive change to healthcare and alleviates pressures on nurses. So over the past few years...
Sorry, Chloe. Hi, everyone. Just interrupt, Chloe. Your slides are... Maybe you just need to close and reopen them. They've gone very large. It might just be on my screen. I'm not sure if you can see from your screen, the audience view, if that's impacting everyone. Does it look normal on your audience sharing screen?
It does.
Okay, fantastic. Probably me. Just wanted to check. Thank you.
Please pop in the chat if you are having any visual problems, and I can stop and reopen.
Right,
but
I'm usually the problem child.
Okay. Thanks, Holly. But please let us know if it is affecting everyone.
Great. Jeannie said it looks great from her side, so I will butt out. Thank you.
Thank you, Holly. Okay, so over the past few years, we've had many conversations with aged care providers, from large multi-site organisations to small, tight-knit community facilities. And while every place is different, the training challenges feel very familiar. We've listed some of the main ones here. I don't have enough staff and my team is overworked. We face geographical barriers, which happens a lot in Australia. Connectivity can be an issue in remote areas, but we also know in-house you can have some connectivity issues. Staff turnover and recruitment challenges are something that happens all the time. The difficulties in IPC training are across all healthcare. As listed here, it is an overworked and under-resourced group of people that can be very difficult to get everyone in one room to deliver effective training sessions. But aged care presents some unique challenges, and some of these include there's a high turnover of staff, which means training has to be repeatable and easy to deliver. Then there's the added complexity of supporting staff with English as their second language. This can make comprehension a real hurdle. We also need to consider that many aged care workers don't come from a healthcare background. In fact, they often have more day-to-day resident contact than some of the clinical team, which increases the risk when it comes to IPC practices. And of course, our residents are particularly vulnerable. Even minor outbreaks can have serious consequences in aged care. That's why practical, effective training matters so much. Most organisations have some form of training that begins with either an induction or an orientation. This is sometimes one-on-one with an educator, but is often done online, e-learning, as this is what is easily accessible and scalable. Then we enter day-to-day BAU. Protocols don't necessarily change often, but there is a chance outbreaks reoccurring, requiring enhanced PPE use. Then we move down the track, and it is shocking to know that so many healthcare workers are not confident in PPE donning and doffing technique. Studies show that this is the case even in places where PPE use is a regular occurrence. With hand hygiene, people often think they're doing well, but audit results often tell a different story. Clearly, something in the process needs to shift. And this is really important. It's not that people aren't trying, it's that the systems we use to train and support them don't always work. We rely on posters, PowerPoints, and train the trainer models. These tools do have value, but then we enter what we like to call the black box of hope. We hope the training is consistent, we hope it sticks, and we hope that staff feel confident. But hope isn't a strategy. And most of the time, we only realise something's broken when something goes wrong or when we get to audit time. Let's take a quick break from me talking and show you a short 2-minute demo video of Bloomer in action. What you will see is a sample of a donning demonstration with prompts and feedback. Remember, everything that you're going to see is fully customizable to match your organization's specific protocols.
Please show your hand to choose a protocol. Welcome. Our hands have the power to heal or harm. The outcome depends on how we choose to use them.
A patient is in contact precautions, requiring you to wear gloves and a gown when interacting with the patient. On your morning rounds, you notice the patient is coughing, and they report to you they've been feeling unwell overnight with a fever and vomiting. What PPE precautions should you take with the patient? Correct.
Perform hand hygiene. Done. Put on gown. Ensure neck and sides are secured. The neck of your gown seems loose. Turn around and please wait. I will check the back of your gown. Checking back of gown. Gown open at back. Please face the screen again and review the back of your gown. Turn around and please wait. I will check the back of your gown. Checking back of gown. Please face the screen again and review the back of your gown. Done. Put on your mask. Mold the nose piece. Base of mask under chin. Done. Put on gloves. Cover the cuff. Show your hands upright when done. Checking wrists. Your left wrist doesn't seem covered. Your right wrist doesn't seem covered. Done.
Great. So now that you've seen Bloomer in action, let's unpack what's happening behind the scenes there. Blue Mirror uses computer vision AI to see and respond your movements. There's no facial recognition, no recording or storing any videos or images. All the data stays local. The prompts, both visual and audio, are customized to reflect your facility's protocols. The setup is a collaborative process. We work with you to get it right and support you as you roll it out to your staff. It works on a variety of devices such as iPads, Surface Pros, desktops, laptops, and we can provide you with a full list of compatible devices. And with the SteriMat training station, you've got a fully mobile practical training setup. You can take it to wherever it's needed, perfect for training sessions, assessments, etc. One of the biggest advantages of Blue Mirror is its ability to provide instant, in-the-moment feedback. Whether someone's gown is not on correctly, their hand hygiene time is too short, or their gloves aren't fitted properly, Blue Mirror picks it up immediately and guides them to correct it. This kind of real-time correction makes learning powerful and memorable, and so it sticks. We also include scenario-based questions to help bridge the gap between theory and practice. You can create your own scenarios and tailor them to suit different departments or roles. Staff select from multiple choice answers and receive instant feedback, helping to build confidence and reinforce their knowledge in real time. Consolidating theory works best and goes hand in hand when combined with practical assessment. By switching to audit mode, you can assess staff without instructional prompts, simulating real-world conditions. At the end of the assessment, you'll receive a detailed report showing the outcomes, along with prompts to either retry or undertake additional training. This ensures your users receive real-time feedback, helping to reinforce learning and highlight areas for improvement. One of the new standards highlights the importance of also training visitors. This is a great step forward, but also a bit of a challenge for facilities that are already stretched thin. Blue Mirror makes it easier. You can create simplified protocols just for visitors, something quick and effective that teaches them how to wear a mask correctly and wash their hands properly before entering the facility. Different roles need different training. That's where role-based protocols come in. For non-clinical staff, you can use simplified language and focus on the essentials. For clinical staff, you can offer more detailed protocols that cover technique and IPC principles thoroughly. It means everyone gets the training they need, no more, no less. You can include scenario-based questions that are tailored to their specific roles. For instance, a receptionist doesn't need clinical scenarios, but rather situations that reflect their typical responsibilities. An example could be your receptionists. A patient could arrive at the facility struggling to walk a bit. You decide to assist them by offering the hand and helping them to the waiting room. Your question could be a scenario around that, and your answer would be, your question would be, at what point would you perform hand hygiene? Obviously, for clinical staff, the scenarios should be more focused on clinical situations relevant to their duties. As you can see here in the image on the left with our SteriMat training station, you have a completely mobile PPE and hand hygiene training solution that's on wheels. You can move it around, you can use it for your practical training, competency assessments, or have it stationed in specific units to support your organisations during an outbreak. And this just adds an additional feature within your facility to access it nice and quickly. This is some feedback from a client with multiple facilities and what they had to say after using Blue Mirror for more than a year. When we asked what led you to reaching out to Blue Mirror initially, they responded with, we wanted a solution that would provide education, simplify record keeping, ability to run reports in real time to demonstrate compliance and staff competence. They needed an innovative solution to address their training needs, and Blue Mirror stood out due to its advanced AI capabilities, ease of integration, and access to support. We also asked them how did they approach the transition of new technology with staff. Initial planning, ensuring that there was dedicated time for this rollout and customization. training and support, ensuring Blue Mirror was there to support them with their training needs and issues as they popped up. A phased rollout, being strategic in which sites they chose to go live with first, and having feedback loops, having a structured feedback loop from staff back up to management. And finally, when asked what is the biggest improvement, advantage or benefit you have noticed since adopting Blue Mirror, they told us increased operational efficiency, reduced downtime, better understanding of importance of fit checks and donning and doffing, and increase in staff skill. Now, let's talk about the back end. The admin console is sort of like what we like to call the unsung hero of Blue Mirror. It's packed with features to make managing training easier, from scheduling and tracking training to reporting. You get a clear view of how training is going across your organisations and also have the tools to tweak and improve as needed. You can also integrate it with your learning management system, and it's scalable from small facilities to large networks. We are built to integrate and have several options to suit the largest organisations right down to the smallest. And finally, recognise the efforts of your team members with full certification management. Now, we are currently offering a package called Blue Mirror 360. It's an all-in-one package designed for small sites, or the perfect way to try Blue Mirror in a larger organisation. It's everything you need to get started. It comes with a 1-year subscription of Blue Mirror, an iPad, and the SteriMat PPE training station. So whether you have a single site or you're evaluating a rollout across your organisation, Blue Mirror could be a good option for you. It does say that it's up to 150 staff. If you have more than that, please reach out to us, as we may be able to tailor this around to suit your organisation as well. This is only valid until the end of June, so please reach out if you're interested in exploring this option. At the end of this webinar, you will receive a survey from us as well as some feedback about the session. You can let us know if you'd like to book a time to do a one-on-one demo and discuss any other pricing for your organisation. Our global footprint, we're proud to be supporting healthcare teams in New Zealand, Australia, the UK, Singapore, and the US. Every facility is different and every facility uses Blue Mirror in a slightly different way. Our ability to tailor the solution to each one is what makes it work so well across the borders. That's a wrap on the presentation side of things. We'd love to hear from you. As I said at the beginning, feel free to drop your questions in the chat box, or you can send them privately or to the whole group. I will pass over to Holly. Have you got any questions there?
Yes, I have. Some good ones too. So just remember, everyone, you can ask in the chat box or the question, and you can either send it to everyone so we can all see, or you can do what these ones have come through privately. So first of all, we've had a question: how are people actually using it? Just for one-off training or refresher training? Which is a very good question. So in aged care, and like Chloe said, all of our customers so far have adopted it to suit their needs, and all slightly differ. Currently it's being used in aged care for orientation training, refresher training, ad hoc training if they've got people that need to practice a little bit more, and also for competency checks. So they essentially have a station set up in their different facilities that's accessible to all their staff all the time. So no matter what shift you're working, you can just pop in and do your Blue Mirror training session. You can receive those notifications either through Blue Mirror to your email, or they get managed by their clinical education or charge manager. And they are told that they need to do hand hygiene training or donning and doffing training, or all of it. And so that's currently how it's used. And the beauty in that is the accessibility, because obviously for any organisation with a large number of shift workers, it's really hard to get everybody together in a group to plan training all at one time. And so that just means that people actually have the freedom and the autonomy to do their training when it suits them. And it also means that they can train when it's a nice relaxed session, and if they want to, they can train more than once and practice, particularly for those new to healthcare. Next question is, do you need internet to use Blue Mirror? So we do always get asked this, and Chloe mentioned right at the beginning of the presentation about connectivity. And so there's two parts to Blue Mirror. There's the application itself, where people are using it to do the training, and then there's also the admin console, which is what the management team or the education team would use to see all the data from Blue Mirror. So to use the app, you don't need to be connected to the internet, which is really good because it's not even for rural healthcare facilities. There seems to be an issue with connectivity in almost every healthcare facility, even the metro ones. And so you can use Blue Mirror whenever you like. Once it's back online, it then syncs to the admin dashboard, and that information is then updated. So as long as it syncs at some point, that information will be there for the managers to see all the data from those sessions. How much time is typically required to implement Blue Mirror? This really depends on the facility, to be honest. With the Blue Mirror 360 promotion that we're running at the moment, the whole concept around that is a plug and play option, because a lot of, particularly the smaller facilities, they don't necessarily have a dedicated infection prevention control manager or someone that's got the time to manage a project, or they may just not have that many staff and might not need that. So with Blue Mirror 360, it's preloaded with the donning and doffing and hand hygiene. You can also have visitor training on there as well. And then it's all good to go on the SteriMat PPE training station, which is a mobile training station, and you can park it wherever you'd like it in your facility. With larger organisations, that requires more project management. So we absolutely walk you through that process the entire way. Depending on how large you are, it might be a phased rollout, but always we work with the dedicated key project lead from the organisation and roll that out in a way that's going to be most successful for you. So it really does depend on the size. We can do, for smaller organisations, we can be up and running within 1 to 2 weeks. For larger organisations, probably we'd do that within a month, well before that in most cases, but we like to work with good timelines and planning for that success. What is the reporting available? Okay, so Chloe did show a screenshot before of the admin console. Now that's very, I think, oh, Chloe, do you just want to keep sharing your screen? Because I think it's gone back to your PowerPoint. The reporting that's available on the admin console, we capture all of the data in the training sessions. So you, with the exception of the image of you in any video or photograph of you, we don't capture any of that, but otherwise the statistical information is all stored in the admin console, and you can cut and slice that information however you need to. So you can report on individual people, a role, so you could look at all your nurses or the non-clinical staff or the doctors, or you could then move through and even report on the different facilities. So there's fantastic dashboards there for you to see. It's really easy to use, and if you do need specific reporting, then we can align with that and build some reports that give you the information that you need, just to make things a lot easier. Okay, I think I answered those ones. Are there any further questions? So as Chloe said, we will be sending out a little survey at the end of this webinar. If you could just take 5 minutes to fill that out, that would be fantastic. For us, it's really important to get feedback to make sure these sessions are useful. We also would like to know if there's any extra information that you'd like in subsequent webinars that we're planning. And then also, if you want us to contact you, we can, specifically regarding the Blue Mirror 360 deal, or also the pricing for your organisation if it's a large one. So I think that's a wrap, Chloe, unless you've got any questions that have been directed privately to you.
No, I haven't got anything on my end.
Okay, Great. Okay. Well, thank you very much, everyone. Really appreciate your time on the call today. Thank you, Chloe, for the presentation. That was wonderful.
Thank you very much. Thanks,
See you,
everyone.
everyone. Thanks. Bye.